So, what have been some of the most effective strategies you've implemented to advance equity in public health workforce programs?
I've had a chance to work across a range of priority populations. I've led evaluations for programs serving African American individuals, also serving women in particular, as well as older adults, which are all very important priority populations in terms of ensuring access to services, access to care, and things of that nature. Um, and then I would say, I don't want to say more interesting. It's mostly because it's unexpected and it was a new opportunity for me. I had the opportunity also to support some clinics in terms of patient engagement and patient communication, specifically for Iraqi, Burmese, and Bhutanese populations. I'm based in the Dallas area. I'm originally from Cleveland, Ohio. So I say pop and I say y'all. Um, it was at the time a refugee resettlement area here in Dallas for those particular population groups. And so just having the opportunity to engage in the equity work relating to linkages to services and healthcare access was a really special opportunity. And our clinic leads were certainly interested and engaged in the work as well.
Well, thank you for sharing that, and that's fascinating. And I think it goes back to like I'm thinking about like the current landscape and just how we have to think about ways people that are looking for jobs in public health right now have to think about maybe like more unconventional, untraditional ways. And I think like just mentioning patient engagement from that perspective is something that people might be wanting to look into nowadays as a viable like career path or beginning path. So just and I feel like that's one of the big takeaways in like listening to a podcast like this is like people share career roles and titles that you can research and look into and really find positions in. So appreciate you sharing that as well as the work that you were doing there.
Yeah, I think especially for our line of work, we can't be too attached to a job title because it might be different wherever we go. You might have a manager in one place that has more responsibilities than a director in another place,
Mm-hmm.
or you might have, um, titles that are kind of non-traditional, like performance improvement manager. Well, you may not find that at another health department right now or another nonprofit right now. But it doesn't mean that there's not someone responsible for doing the work of evaluation, for doing the work of convening. So I find it helpful, and I often recommend to the students that I support or colleagues that I might be speaking with to search based on what you're good at. Don't put a job title in the search bar, put your skills in a search bar and the word public health and see what pops up. So it allows for some flexibility, some room, some titles that you may not have heard of. I think the longest title that I've heard of that was doing some amazing and important work was like firearm harm violence prevention. So would you necessarily think to put that in the search bar, assistant or coordinator or manager? Not necessarily. However, you can enter violence prevention, injury prevention, and then jobs would come up. So having a level of flexibility and creativity is always good.
Yeah, and I appreciate you highlighting that. And to that point is like you don't want to put yourself in a box when you're looking for jobs. And to the point of like public health skill sets are so transferable to so many different places. It might be that you can do the type of work that you're thinking about just in a setting that you never thought about. So I think like having an expansive way of looking at jobs and looking for careers and focusing on how am I developing the skills and being able to apply that in different places, I think is a really good lens, especially now and thinking about how you could continue and move forward in your public health career.
Absolutely.
So you specialize in data-inspired program development. Can you share an example of where data insights led to a major strategic shift in a public health program?
Sure. I would say I just naturally lead with data in my work in general. My background at the undergraduate level is quantitative. And then my doctoral studies were mixed methods. So I leveraged surveys and then also interviews. And so, really, multiple projects that I've led involved looking at quantitative data, which might have related to a patient experience or might have related to access to care, for example, or we have quantitative training data. And then from there, you really have an opportunity to look at what are gaps and what are needs based on the numbers. And so, if I use the example of training data, it really provided a data based, data inspired opportunity to create new trainings, to encourage participation in existing trainings. At the time, health equity trainings weren't as well attended, financial trainings weren't as well attended, and we had the data to prove that. And so then from there, you can craft a curriculum, you can invite subject matter experts and make sure that you have resources in place to deliver trainings that are needed. So, I think data is a fun place to start. I think data should also be used to tell a story because it's not often relatable to everyone just at face value. And so a lot of my time truly has been spent translating the numbers into something that is also meaningful and that a program can emerge from. At the larger level, if you're looking at data for a disease like breast cancer, for example, you can examine what cities have the largest breast cancer mortality rates or what populations in those cities have the largest mortality rates. And then that's where you start crafting prevention programs, access to care programs, screening programs. So it's using the numbers to determine what is needed here and to make sure that the numbers don't just live on a shelf or in a dashboard, which dashboards are amazing. I love them and kudos to everyone who does them. And, it's just, there is an important opportunity for the dashboard experts to talk to the program experts.